Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. This one comes in from Reddit. It comes with a picture, which we will show you. And the question is, extreme hair loss at 24, female. This is after one hair wash and one pass through with my brush. I wash my hair every day and brush every day. I've got my thyroids and all vitamins checked and everything is normal. Everyone says nothing is wrong, but it's driving me crazy. Well, that's a great question. It's actually something we see an absolute ton of. As I always say, your best bet is to get to see a local board certified dermatologist who can do a workup on you. It sounds like you may have already done that. I don't know if you went to a dermatologist or a primary care doctor, but the first step is with hair loss is doing like a very extensive panel of blood work. Usually my patients will come to me who have this condition and say, I had blood work done. I said, let me take a look at it. I do a very extensive panel of blood work for hair loss. And if something is not on that panel, then we recheck those tests as well. So if you're in the New York City area, come see the doc. I'll be happy to take a look at your blood work and see if I can help you out. But if you're not, I would recommend getting in to see a board certified dermatologist if that's not who you saw, if that's not the person who did your blood work. Now, based on what you're describing, and I might be speaking out of school, but it sounds like you're having very profound, dramatic hair loss in like a short period of time. So this is like a new thing for you. Like in the last couple of weeks or month, your hair is shedding like crazy. And I'm assuming here. So if that's not the case, then of course you'll review the proper history with your dermatologist. But assuming my assumption is correct, most likely what you have, and again, this diagnosis is based on kind of the extreme hair loss that you're showing in the picture that you shared, combined with normal blood work. A very common type of hair loss is something called telogen effluvium, which is a like quote unquote stress induced type of hair loss. So lots of things can cause it. For instance, like during COVID, we saw a ton of this, like folks who were getting, either got COVID or really from the COVID vaccine as well, were experiencing dramatic hair loss like a couple of months after either having like a bad case of COVID or getting vaccinated. It can happen with, post-surgery. It can happen postpartum. So after delivery, a month or two after delivery, some women may experience profound hair loss. It can happen from actual emotional stress, like loss of a loved one, breakup, something very traumatic or stressful happening. A couple of months after that happens, your hair might shed. The good news is, if that is the diagnosis, the prognosis generally tends to be very good. So what happens is telogen hairs are the hairs that are shedding. They're like your dormant hairs, and those are like the 100 to 150 hairs. Like everyone loses a day, quote unquote. But when your body's under duress, it doesn't think hair is important. So instead of don't quote me on these numbers, but instead of like 0.001% of your hairs being in telogen, it might be like 0.001% of your hairs are in telogen. So instead of losing like 100 hairs, you're losing like 1,000 hairs or more a day, which appears very, very dramatic. But the good news is hair kind of goes in a cycle, right? So the telogen is the resting phase, then it goes into something called anagen, which is the growth phase. And those telogen hairs are the stem cells on those hair follicles are programmed to go back into anagen. Usually this is not happening all in sync. The hairs are going into telogen and anagen in different phases. But when you have telogen effluvium, everything kind of lines up. So you shed hair like crazy, then like nothing much happens, and then your hair all starts to come back. Again, this is all based on blood work and an exam by your dermatologist. There are some other treatments that we do to help sort of mitigate telogen effluvium. Something that's quite popular in my practice is something called PRF injections, or platelet-rich fibrin injections, which I have a bunch of videos on that if you want to check those out. But as I said, I'm rambling on here. Your best bet is getting to see a local board-certified dermatologist who can review all of the things that I just discussed with you. I hope that answers your question. Let's get it.